everyone. Thank you for joining us today. We're so excited to have you here and to have Sarah Kabe discuss the promising two-generation initiative and other developments going on in the education sector. We'd like to continue having sessions like these and do more of them in the future, so please let us know if you enjoy it. We have questions available at the using the excuse me, use the Q&A feature. If you have any questions, we can address specific questions one-on-one, and we will collect broader questions at the end for Sarah to address. We'll also have contact information available at the end if you'd like to engage with IPA and the education sector further, and I'll drop our email in the chat. So thank you all for joining us, and we're so excited to hear from Sarah.
Okay, with that, I think I'm happy to kick things off. So again, thank you so much for joining us here today. We're really excited to be able to connect. Just again, some of the quick housekeeping. We're going to start with the presentation, but please feel free to submit any questions or comments into the Q&A feature, and we'll have some time at the end for discussion. Again, thank you so much for joining. It's always an exciting opportunity to be able to connect to IPA supporters. And as always, thank you so much for your support. But this is also an exciting opportunity because we get to share some of our ongoing and active projects. So really looking forward to being able to talk about some of the work that we are currently doing. So just to quickly outline the agenda for today, I'm going to start with an introduction to the education sector and to sector programs more broadly at IPA, in case you haven't connected with one of these programs directly before. And that'll include, I'm going to highlight a couple of our active projects. So just a quick spotlight on some of the work that we're currently doing as part of the education sector. And then get into more of a deep dive for our two-generation initiative. This is some of the newer work that we're really excited. And so presenting some of our recent studies, but then also some of the work that we are currently doing as part of the two-generation initiative. And so that would be the bulk of the presentation today. And then I'm going to conclude by discussing some future directions. So some areas that we're really interested in and looking for opportunities to work on moving forward. So to get started, education is one of IPA's sector programs. So at IPA, we work on a range of different issues, and we have sector topics, and we have a portfolio of projects that all speak to a particular issue, such as agriculture, health, and nutrition. But we have sector programs when we have dedicated sector staff. So with that individual sector expertise, working on particular topics. So there's a lot of diversity in our sector programs. They work on different issues and they represent different fields. But here are some of the core activities that all of our sector programs work on. So this idea that dedicated staff with subject matter expertise really working to advance these strategic research policy and practice agendas. But also a really important part of the sector program's work is collaborating with other IPA teams. So this is particularly important for education, where we have a lot of work in policy with our right fit evidence team and research methods. And so across all of our country offices, we have education projects. So just a few numbers here. We've completed over 90 RCTs related to the topic of education. We've over 300 researchers and our network interested in working on education projects. So this is an area, a sector where we have a lot of work across IPA's teams and across our different country offices. But one way that I think about the education sector program at a really high level is work across these two areas. So the first is making connections, right? So identifying where different projects are addressing similar questions or could use similar measures, or there's interested opportunity for alignment. And so the work to promote the quality of and support our existing work, but then also filling gaps. So identifying where there are key evidence needs and demand for information from our partners, and developing the work to be able to generate new evidence. And so at a really high level, I think of the sector program as working to make IPA more than just a collection of individual independent projects. So really working on that strategic alignment and contribution to the field of education. So for the education sector, I'm just now going to quickly highlight a couple of our active projects to give you a sense of some of the things that we're currently working on. And so the first is scaling differentiated learning. So differentiated learning, or DL, is a teaching at the right level inspired intervention, right? So teaching at the right level is a program developed by Pratham, an NGO in India, recognizing that can be really effective to teach children according to their ability level, right? So not in relation to their grade or age necessarily, but assessing children's foundational skills and tailoring instruction to their ability level with active pedagogies. And so DL is inspired by that approach and that perspective, and so implementing that type of programming in Ghana. What's really exciting is that this is an initiative that has spanned over a decade, right? So IPA's collaboration with the Ministry of Education and Ghana Education Service began in 2008. And this work has included 2 phases of implementation research. So we've conducted 2 different RCTs that have assessed 6 different treatment variations. Right, so this is the work needed to be able to identify, okay, what is the most cost-effective way in which to implement this program, but that can be sustainable and scalable in the existing education system. So really excited to have this body of work in Ghana collaborating with these different institutions to test different approaches and strategies for implementing the best version of differentiated learning. We're really excited that currently, as a part of the Ghana Accountability for Learning Outcomes Project, or GALLOP, the most effective, successful version of differentiated learning is now being scaled to 10,000 schools. And so as part of this, IPA is continuing our collaboration with Ghana Education Service to support the scaling process. So this includes additional research questions, looking into things like digital teacher training or how to motivate teachers to improve implementation rates, as well as capacity building and support on monitoring and data collection processes and supporting local and regional actors involved in scaling. So the second project I'm going to highlight is a collaboration with the Right Fit Evidence Unit. So this is the Partnership for Tech, or P4T initiative. The goal here is to help realize the potential of technology to improve education outcomes globally, and really looking at this long-term evidence-based vision for what EdTech can be. So this project involves a couple different scopes of work. So partnership and advisory services with EdTech service providers. So recognizing, collaborating with EdTech service providers to use data and research and evidence on a regular basis, but also support them so they could potentially be in a position to generate new evidence. It is a really important part of supporting the sector. But they're also going to be providing support this year for 3 RCTs, recognizing that we need a lot more causal inference, in particular in EdTech, to understand, are these interventions realizing the outcomes that we're most interested in? And a key part of this perspective is we're hoping to advance the conversation about EdTech in a couple of key ways. So emphasizing the importance of equity issues, right? Recognizing the field of EdTech in many contexts potentially could be exacerbating inequality rather than working to ameliorate it. And that's important to anticipate some of the implementation challenges for tech interventions, right? Oftentimes, ed tech is seen as a way in which to streamline implementation or make it less costly, but often digital strategies introduce a range of new challenges for implementation. So it's important, especially for research, that there's attention to the challenges and important issues related to implementation. And then finally, that these interventions and these programs and services are not just tech for tech's sake, but that there's a meaningful connection to education, and that this work is connected to a really deep understanding of education systems, the actors within them, and the challenges that they're facing. So the final project that I'm going to highlight is our soft skills measurement initiative. And this is a collaboration with the research methods team, as well as the social protection. And the topic here, the sort of motivating question is, are soft skills associated with labor market outcomes? Right? There are many different organizations and programs right now focused in education systems and beyond about how we can support young people and others to develop soft skills, recognizing, right, that not just basic academic skills are really important for people's entrance into the labor market and success in the workforce. But which soft skills are most important? Which ones are actually predictive of later labor market outcomes? Our ability to answer those questions often really depends on our ability to measure soft skills. And so this initiative is focused on those measurement concerns. So we've been conducting a literature review of existing research on the predictive validity of soft skills measures. So which measures, which soft skills have an evidence to show that they are predictive of later labor market outcomes. And then through a competitive research fund, we were able to support measurement work on 7 different studies. So providing some additional resources to existing studies so they can devote more attention to measurement, and in particular focus on this question of predictive validity and determine, sort of what do we see about, sort of soft skills and the different measurement approaches, whether that's, sort of self-report and some of the challenges there, observation tools or situational judgment tests, what different measurement strategies can improve our ability to assess soft skills to be able to better understand their potential relationship with later labor market outcomes. So those are just three of the topics or three of the projects that we are currently working on in the education sector, just to give you a sense of the scope and different collaborations with the policy team, right, Fit Evidence and others that we're working on. But then the focus of today is going to be more of a deep dive into our two-generation initiative. So this is some of our one of our most recent initiatives. We're really excited about the work that we're currently doing and directions moving forward in the future. So to start, what do we mean by two-generation? So this is a picture from 1965 and the launch of the Head Start program, which is often cited as the original two-generation program, or one of the very first and most influential two-generation programs. And so the core focus, or what many people know of Head Start, is that's an early education experience targeted for children in low-income families. So it provides a preschool, a pre-primary education experience, but supporting children's holistic development and school readiness so that they're able to enter kindergarten. And that in itself was somewhat revolutionary because this Head Start program was launched as part of a broader policy initiative referred to as the War on Poverty. So it was really exciting that attention to very young children and early childhood development is recognized as a critical strategy for combating inequality and addressing poverty, recognizing that inequality manifests in very young children. And so I'll return to that point a little bit later. But what made this a two-generation program is that not only was there this direct service provision for very young children, but there were also these other services for the adults in their lives, right? For the parents and caregivers. So in some cases, this was links to other services, for example, ensuring that families have access to food stamps or other forms of assistance that they qualified for, but then also sometimes direct programming for education or workforce development, job training for caregivers. And so that, I think, really resonates with our understanding of what two-generation means. And so as this initial definition highlights, the structure and content of two-generation approaches vary pretty dramatically. But, sort of there's some core focus. You see in the second definition highlighting educational success, for children, economic prosperity for adults. But what I often focus on, or what I think is most compelling about a two-generation approach, is this idea of explicit and intentional targeting of both children and their caregivers. So you see, this is not a new idea, right? So the Head Start program has been and continues to be implemented, over the past 60, 70 decades. But then also there's been a wave of new interventions and organizations working on policy and programming on two-generation approaches. And over the past decades, this has often been very responsive to the particular political or policy environment of that time. So for example, the emphasis on workforce programming in the 1990s really changed the dynamics of some two-generation approaches. And so there have been different waves and phases of this work in the United States context. But then what we've been interested in is exploring, well, how might two-generation strategy and approaches be relevant for global contexts and international settings? So recognizing that across different countries and contexts, there's a different landscape of actors and interventions, political and policy contexts, and the dynamics vary both in the way that similar issues can manifest in different ways, but then also there are different settings and dynamics affecting young children and caregivers in different contexts. And in approaching this work, we think, two-generation strategy really presents an opportunity to address key evidence gaps. So I'm going to summarize a couple of them today. So the first I describe is the ECD perspective. So I'm going to report some results from this study by David Evans, Pamela Chiquila, Heather Nauer, looking at the effect of intervention or early childhood intervention on mothers and other actors, or more succinctly, the lack of perspective to understanding how these types of interventions influence other actors. So they identified almost 500 studies assessing the impact of early childhood development interventions. They found that less than a quarter reported any outcomes for mothers other than their parenting practices, right? So other than their direct interaction with children or knowledge of child development, less than a quarter reporting any other outcomes for mothers. Only 3% reported any outcomes for fathers, including their parenting practices. And only 1% reported impacts on older siblings or other members of the family. Right. So the key takeaway here is that current research on early childhood intervention typically does not incorporate much of an attention or focus on other actors. One of the ways in which we've been thinking about that is we have a lot of work focused on the expansion of pre-primary education at the moment. right? So different ministries and governments around the world have been working to expand access to pre-primary education. So educational experiences for children who are 5, 4, 3 years old, but better enable them to enter and successfully advance through primary education. This is often framed exclusively in relation to children and child outcomes. But there are many different potential pathways through which you could understand how these interventions could influence their adults, and why, that the study by David Evans and others recognizing that we really aren't assessing these outcomes is an important lack of perspective. So for example, framing pre-primary education as childcare opens up this window to understanding impacts for caregivers and other household members that could be an important part of this discussion about expanding pre-primary education. This isn't the only pathway through which early childhood programs could influence caregiver and other household members' outcomes. So just as an example, there's this really interesting study from Bangladesh that was looking at various WASH interventions, right? So trying to reduce the disease burden on very young children and address infant mortality. So implementing water, sanitation, hand washing interventions. What was really interesting was that they implemented a range of different treatments and different programs, but they found very similar impacts across the different interventions. So trying to understand, what biological mechanism or what was happening there, one of the hypotheses that the researchers had was that maybe what was in common across all these different interventions was that it improved maternal well-being and reduced maternal depression. Right, so in some contexts, mothers were very socially isolated, working in the home, and these interventions had a community health worker visit the household. And maybe that was a key mechanism for reducing maternal well-being or improving maternal well-being, reducing maternal depressive symptoms, that it was the underlying mechanism improving child outcomes, so leading to the improved cognitive outcomes that they saw for young children. And so this illustration, I think, recognizes that not only by not assessing outcomes for other caregivers or other household members, are we not understanding the full picture of impact of early childhood intervention, but we might also not be understanding existing intervention in and of itself and what underlying mechanisms are driving the impact or lack thereof. The other lack of perspective that I'm going to highlight, though, is from the household, right? And this question of, well, do household level interventions translate into impacts for children, right? The previous perspective I was talking about was that many early childhood interventions and programming and research do not consider the perspective of caregivers and other household members. But here we have interventions targeting the household or targeting adults often does not consider how they might be impacting children. So we do have some promising research from cash transfers and other literature, but many poverty alleviation and livelihoods programs aren't assessing outcomes for children, understanding how these household-led interventions might or might not be influencing children. And there's some emerging research to suggest that we really need to look into this and better understand those dynamics. So for example, a recent study conducted by IPA with researchers Lasse Brun and others assessed the impact of the graduation program. So this is a holistic livelihood support program targeting ultra-poor populations. It's been assessed in contexts around the world and found to be very cost-effective, one of the most successful interventions we have for alleviating extreme poverty. This was conducted in refugee and host communities in Western Uganda. It was really exciting that they found positive incomes across a range of different outcomes. So all the different indicators that you would want a graduation program to improve, with some positive impacts on household income, consumption, food security, but no observed impacts for children. And they conducted 2 different phases of data collection, assessing a broad approach to holistic children's early development, and didn't see any impacts. And so the researchers argued that, the results suggest that the benefits to the household, the benefits to the adult in the household did not flow down to the youngest children. So maybe targeted early child intervention is needed in order to generate impacts for children. So this is just highlighting that many household and poverty alleviation interventions aren't assessing outcomes for young children. Maybe they're assuming that they will necessarily impact early child development, but we need more work to better understand that and investigate why certain interventions might influence children or not, or also the possibility of integrating early child intervention into these types of programs. So this leads to some of the key questions that we have motivating our work on two-generation. Right, so how can we develop a more complete understanding of impact by considering multiple family members and perspectives? Is existing intervention enough to disrupt the intergenerational transmission of poverty, or when do we see household level or adult impacts translating into impacts for children? But also, how does household poverty constrain the effectiveness of educational intervention? And using this understanding to how can we design the most effective two-generation approaches for diverse global populations and settings. And ultimately, what we want to work towards is to be able to answer the question, can two-generation programming generate breakthrough outcomes for the most vulnerable children? That's what we ultimately want to be able to know. So that's some of the background and motivation and research that's inspiring some of our work. And now I'll highlight some findings and preliminary insights from some of the work that we're currently doing. So our first project to take an explicit two-generation approach was a collaboration with the International Rescue Committee. Their child protection team in Tanzania has been implementing their Families Make a Difference program. This is one of the IRC's core parenting programs that they implement in multiple different contexts. In this case, in Nyarugusu refugee camp and neighboring host communities in Tanzania. And our question was, how could this program incorporate more of a two-generation approach? And to inform this project, we conducted an evidence review focused on parenting programs and understanding parenting in contexts affected by forced displacement. And like the research that I cited earlier about early childhood education more broadly, many parenting programs don't assess any outcomes for caregivers other than their parenting, right? Other than their direct interaction with children or knowledge of child development. And so one of the things we looked at in this evidence review was what opportunity do parenting programs present to take more of a two-generation approach? What kinds of outcomes for caregivers could be targeted that would be important in and of themselves for the caregivers in the household, but could also potentially make the parenting program more effective and also better enable parents to support early childhood development through many direct and indirect pathways, from improving the environment, improving their interactions with children. And so we conducted this evidence review to help identify evidence-based other research ideas and programming that could inform this project in Tanzania. And so we addressed a couple of different themes, including adolescent parents and other topics as part of this project. But the one that I'm going to highlight is focused on mental health and caregivers' mental health. And our question was, could this parenting program be an opportunity to improve caregivers' mental health, in addition to supporting caregivers in their work to promote their children's early learning and development? And so we piloted two approaches. So this was an exploratory study. This was not a randomized evaluation, but this is the type of early piloting and prototyping work that we think is really useful to help organizations develop evidence-based interventions. And so two of the content or adaptations to the program that we piloted were focused on trying to improve, or two different strategies to improve caregivers' mental health and well-being. So the first was cognitive behavioral therapy, CBT, one of the most popular strategies for interpersonal therapy, psychotherapy, focused on supporting people to recognize negative thinking patterns and other thinking and behavior as a way to improve mental and physical health. The second approach that we took was interpersonal psychotherapy, or IPT. So this is based on the idea that relationships are really influential in supporting our mental health. And so if we're able to improve our relationships, that could be a really potentially effective strategy for improving mental health. And so both of these strategies, both CBT and IPT, we sourced existing research and studies to find content and programming materials from other interventions that have been rigorously tested. We're really excited in particular about this study that incorporated IPT. So researchers Singla Kumbakuma and Abud assessed actually a parenting program in Uganda implemented by Plan. They were really graciously shared the program materials with us, but the parenting program in Uganda had incorporated some of these elements of IPT. So sessions with mothers and fathers, addressing relationship dynamics and communication, as well as how that's relevant for parenting. And so this was implemented as part of the parenting program in Tanzania. And we conducted focus group discussions and qualitative semi-structured interviews, both with the IRC team implementing the program, so the people hosting the sessions and conducting the parenting program, and also some of the parents participating in the program to get feedback about, how did this implementation go? What was their impressions or, feedback about these two approaches to supporting mental health. And so here's a quote from a program facilitator. So this is a member of the IRC team who was conducting this intervention, reflecting on some of the challenges of implementing the CBT content. All right, so this is a challenging context for implementation overall. There are many restrictions on who can enter the refugee community, their movement, the types of interventions that you can conduct there, but also the CBT content presented a lot of challenges, right? So here we see this person reflecting, these are more community health workers, sort of general parenting program implementers. They're not, trained licensed mental health practitioners, which could be a challenge and threat overall, even though the CBT content was designed designed to be implemented by lay workers, so not by healthcare professionals. But they found this was really challenging to implement. There was a lot of confusion over the mental health content. It wasn't a concept that really resonated, or maybe it's hard to just integrate this in a couple sessions in a parenting program that's addressing many other topics. So we really felt that in order to move forward with integrating CBT into this particular parenting program, a lot more work is needed to be able to move that forward. The reflections on the IPT content. So here's a quote from a program participant. So a parent participating in the program, in this case, a mother, had lots of positive feedback. So people felt that this really resonated with the participants. It was relevant for their lives and their challenges they face, the goals that they have for their parenting. So there was a lot of really positive feedback, both from the participants and the program implementers. And again, this was also based on an evidence-based program coming from the Ugandan context. So we think there's a lot of potential here to explore how integrating some IPT content into parenting programs could be a way in which to improve caregiver mental health, in addition to supporting their parenting and promotion of early childhood development. So this is this initial exploratory study thinking about how can we design, implement, and support evidence-based two-generation programs in global contexts. And in this case, especially contexts affected by forced displacement. So particularly challenging settings to implement interventions, but that also present a range of issues and challenges that are really important to address for those populations. We've had a couple other projects incorporate some aspect of a two-generation approach. But then we were really excited by a collaboration with the Conrad Hilton Foundation, with support from their Refugees Initiative. We were able to advance a project that we're currently working on that was able to work on multiple scopes of work. So with a focus on two country contexts, Colombia and Uganda, and a focus on populations affected by forced displacement. So Colombia and Uganda are two of the countries hosting the largest populations of people affected by forced displacement that also have a progressive policy context that are working to incorporate refugees, migrants, and other non-state actors into existing public services and other types of programs. So in this initial phase of work, we've been able to advance a couple of different activities and projects that I'm just going to quickly highlight today. So the first is some of this landscaping and scoping work. Again, going back to the point about two-generation programs reflecting a particular context, a particular political landscape, a particular time. And so across Colombia and Uganda, we conducted interviews with policymakers and government institutions, implementing programs and practitioners and researchers to better understand, are there current programs that are implementing a two-generation approach? What other types of interventions are addressing outcomes for early childhood development and for caregivers, livelihoods, and other outcomes for families? What are the most pressing issues? What are the challenges they believe these populations are needing support in order to be able to address? But then also mapping and identifying what are some of the upcoming policy decisions or other issues that could really be informed by either two-generation thinking or approaches, or the need for more evidence and work to support that decision-making process. So this picture is from one of the convenings that we hosted in Uganda to get people interested in two-generation working on relevant topics together to discuss these different ideas and what's most relevant, how to prioritize work moving forward, how to think about which outcomes are most important to target. We also conducted an evidence review focused on childcare, recognizing this is a really important topic, very relevant for two-generation approaches. We have the evidence review available on our website. We also have a summary on VoxDev if you want a shorter version. But one of the motivating ideas here was that there's been increased interest in childcare following the pandemic and recognizing the incredible need for these types of services. But that a lot of the research that's being done is, again, going back to the background and motivation for our initiative, is often just coming from one perspective or a particular field of research. And so our goal for this review is to really highlight and integrate these different perspectives to the topic of childcare. And so one important starting point is to recognize, well, what do we mean by the term childcare? It doesn't refer to a particular program or intervention, right? It's used to signal that this is a service that enables parents to work. So depending upon the context, this could be preschool or nursery or daycare or pre-primary education, I think we also recognize that primary education serves an important childcare role, although we often don't view it as such, because we think of childcare as filling the gaps in service provision. But it's important, so our childcare review, for example, includes an after-school program for older children. So this term isn't a very technical or focused intervention, and that's one of the challenges, I think, in trying to identify research to review in order to speak to this topic and key decisions of people working in the field. So we identified 10 RCTs that were focused on childcare interventions, again, recognizing that the term childcare signals this interest in women's economic empowerment and services that enable parents to work rather than a particular educational approach or program design model for children. All 10 of the RCTs that we looked at assessed outcomes for mothers, but only 6 assessed outcomes for children. Again, sort of recognizing this disconnect from different perspectives. And for this review, while we complemented some of this work with insights from the early child development literature, how more broadly some of the research on pre-primary education or early education services could be really relevant for understanding the field of childcare and that child perspective. But really with this review, trying to address, these siloed fields that policy, practice, research are often separated depending upon this perspective and emphasis. But that also these aren't the only 2 relevant perspectives for considering childcare, right? So the opportunity of childcare services is often referred to as a triple or quadruple dividend, this idea that these types of interventions could realize impact for children, their caregivers, so not just women, but other family members, the childcare workforce, right? So thinking about the expansion and provision of these services, creating new jobs and businesses, and then society overall. If more women are engaged in the labor market, if there's this generation of new jobs and businesses, that there's this potential really multiplicative impact of childcare. But just to highlight some of the complexity and why we think it's so important to incorporate these different perspectives, I'm going to highlight one particular study that we covered in our review. So this is a really wonderful study by Kirtan Burton et al., Salim Galeshi, a team of researchers working on this study in Uganda, and they assessed the impact of a childcare subsidy, a cash grant, and both. I think some of their findings really highlight the complexity and how important it is to take this multi-generational approach to the study of childcare. So for example, they found that the child subsidy increased the labor supply and earnings of single mothers, but there was no impact for mothers living with a male partner. In that context, instead, for those households, they saw an increase in father salaried employment, right? So if they hadn't assessed outcomes for fathers, they wouldn't have seen or understood some of these dynamics, and why wouldn't there have been an impact for those mothers and why there was only impact for single mothers. Similarly, they saw that the childcare subsidy did not impact mother's income if she had a younger child, right? Which makes sense. If you provide childcare subsidy, enable a 3-year-old to go to work, to go to a preschool experience, but you have a 1-year-old child at home, the benefit of that childcare might not be as large as in another context. But they saw the child care subsidy also improved attendance in primary education for older siblings, right? So again, recognizing different household composition, different dynamics for different households, and that the full picture of impact, you really need to incorporate these different perspectives. So finally, the original study found improved child development outcomes for those children who participated in the child care, which was in this case a full day preschool experience. But then this same team, the same research team, did a later follow-up 3 years after the initial study. They found still some improved anthropometrics for the children who participated in the preschool, but no persistent effect about learning outcomes. So it's really critically important and connects to an important field of research and literature in early education focused on issues such as fade out or convergence, or trying to understand in what context and why do initial impacts persist, or why there might be these dynamics related to fade out or convergence, or understanding that. So the key takeaways from this evidence review, I think, really highlight the complexity of this issue, the need to consider the impact of childcare and these different services on multiple actors. We also have a lot of interesting findings around barriers such as costs, how any costs associated with attending might make the ability to access childcare dependent upon, different household income, but also that the impact of on women's economic empowerment might be constrained by gender norms in the workforce. So there are a lot of really interesting takeaways about what we see from the 10 RCTs and related literature currently, but then also stressing the importance for attention to quality and the need for longitudinal work, especially from the educational experience, to understand what might drive the effectiveness and persistence of outcomes for these early education and sort of childcare services. So the next scope of work that I'm going to talk about for our current two-generation initiative is a partnership with BRAC, where they're implementing a two-generation project in refugee and host communities in West Nile, Uganda. We are serving as the learning partner for BRAC on this project. And so they are implementing two of their flagship programs. So this is the graduation program and the Play Lab. So the graduation program has been developed and pioneered by BRAC, but is now being implemented by different organizations around the world. It's one of the most rigorously researched and evaluated interventions that has been shown to be cost-effective approach to reducing poverty. But it's a comprehensive livelihood support intervention targeting extreme poverty. So working with ultra-poor households and combining livelihoods and skills training, cash and food consumption, this holistic approach, recognizing what is needed to support households in extreme poverty. And the other intervention is BRAC's Play Lab. In this case, because it's in refugee communities, it's a version of the Play Lab referred to as the Humanitarian Play Lab, but it's an early education experience promoting holistic early childhood development. In the Ugandan context, this is like a preschool, pre-prime education experience, a center-based early education programming for children 3 to 5. That also includes some parenting sessions to better enable parents to support their children's early learning and development. And so for the first time, BRAC is implementing the graduation program in households that have a Play Lab or have a child attending a Play Lab. And so through our partnership, we've been discussing a lot of different opportunities for learning or thinking about how to approach this project, but then also how this might inform the decision-making of BRAC and other organizations working on similar topics moving forward. And so one question is, well, how to integrate these two programs, and that there's a range of different options. So here's this spectrum that we're trying to illustrate here, where on one end, the graduation program is itself a comprehensive, multifaceted livelihoods intervention. And so it could be possible to incorporate aspects of early childhood development into the holistic model that is graduation, but to better emphasize and make sure there's that explicit connection to child welfare and children's outcomes. On the other end of the spectrum, you could implement the Play Lab, but incorporate some attention to caregiver outcomes and household outcomes. So maybe include some of the graduation program components like life skills or coaching could be a part of the parenting sessions, or cash assistance or other programs could be added into the Play Lab. What BRAC is currently doing is implementing both programs in their entirety. And so the opportunity is to explore ways in which there could be a synergy across these two, or the different pathways through which the different programs could influence each other, and an opportunity to reinforce the messages and mechanisms of these two different programs. So for example, does the childcare provided by the Play Lab better enable caregivers to participate in the graduation program? Do they choose different livelihoods? Are they more productive in their income generating activities? Does relieving a childcare constraint make the graduation program more effective? From the other direction, if the graduation program is able to successfully reduce household food insecurity, reduce stress, have these outcomes that the graduation program has been shown to have across many different contexts and settings, will this better enable children to more meaningfully participate in the Play Lab? Are they absent less frequently? Are they not as affected by hunger? Does this make the Play Lab more effective? But also important to recognize potential unintended consequences or challenges associated with implementing both of these interventions. For example, is implementing two programs at once in their entirety too much of a burden on families? Is this too much of a demand upon their time and their bandwidth? Is this too much information to assimilate in a short period of time? So also understanding, there are different ways these two programs could be combined and trying to get this feedback and learning. So this has been a really wonderful opportunity, conducting workshops and working with the BRAC team. We're also exploring the potential of an RCT we hope to be able to conduct. So really exciting. So the final stream of work that I'm going to highlight from our two-generation initiative is a part of this current project. We've been conducting some formative research studies. So the idea about building a foundation of work that can be used to design evidence-based intervention and inform more work moving forward. So we've been conducting 4 formative research studies. So one focused on time use, trying to understand who in a household is spending time with children, the potential tension between income generating activities and livelihoods activities and caregiving activities, better understanding the household composition, how much time are fathers and mothers spending time with young children, how much time are children spending alone or in the care of other children, understanding some of those dynamics and what kind of activities are happening at the household that are promoting in our children's early learning and development. We have a study looking at in the absence of intervention, just in the status quo, the potential association between caregiver mental health and early childhood development outcomes. Do we see an association there, and through which pathways? Does caregiver mental health influence the likelihood that a caregiver is doing certain early learning and stimulation activities with young children? Does that in turn affect child outcomes? And then looking at this issue of forced displacement and how it might affect household composition, right? So dynamics such as child-headed households or skipped generation households, if we're trying to develop and design effective two-generation approaches, who are the generations to target? How might that vary across different settings? How do we better understand these, sort of household dynamics? And these first 3 studies, we are all incorporating data from the BRAC project. So we're able to look at refugee and host communities and potentially some of the dynamics relating to participating in a livelihoods program, the graduation program, at the same time that children are attending an early education experience. So we're really excited. We're currently working on these studies. We hope that in the next couple months, we'll have some results that we'll be able to share. So definitely be in touch as we're moving forward with sharing. For today, I'm actually just going to focus on this 4th study and highlight some of the insights from there, also ongoing work. But it connects back to some of the rationale for why are we doing two-generation approaches? Why might they be needed? What is, again, the background and motivation that I mentioned at the beginning of the talk? But so this is a quote from a paper by Jack Shonkoff and Philip Pisher arguing for the need for two-generation approaches. What they're saying is that existing intervention is not enough, especially for those children facing severe adversity, right? So if you look at the moderate magnitude of effects achieved by the most effective early childhood development programs, even if we were to improve the quality of implementation of those programs, it seems unlikely that they're going to lead to the type of breakthrough impact that we think is needed to realize the potential of early childhood development to address the needs of children facing severe adversity. And so this relates to our understanding of early childhood development, not only as an important intervention for all children, but potentially really important to address inequality, recognizing that inequality manifests in very young children. And so the reason why existing intervention might not be enough draws on this research from fields such as neuroscience, but this understanding, here's another quote from Dr. Jack Shonkoff, but recognizing that children might not be benefiting from our existing early learning experiences because they've been adversely impacted by toxic stress. All right, so one way in which to conceptualize this is you can imagine we might have a really effective high quality preschool program, but if some children then go home to a household affected by violence, affected by stress, food insecurity, the challenges and stressors of extreme poverty, that might limit their ability to benefit from the preschool experience as well as the other environments undermining that impact. And so this relates to, again, this emerging understanding of how adverse childhood experiences and severe adversity negatively impacts children's development, and that can have lifelong consequences. And so this argument that Jack Shonkoff is promoting here is this idea that, well, then in order to achieve these breakthrough outcomes, in order to really meaningfully change the life prospects of children in extreme poverty and other conditions of severe adversity, you have to support the adults who care for them, right? And the communities in which they live. So it's direct intervention with children might not be enough. You also have to support their caregivers. So it's a really compelling argument, I think, for two-generation approaches, but why we need research and work moving forward to be able to assess the potential of these strategies to actually realize that impact or outcome. And so this relates to the study that we're conducting, looking at this question in global contexts, right? Because much of that research and evidence is all focused on high income contexts. And so here we're interested in exploring, this potential equalizing potential of early childhood intervention, right? So does existing early childhood intervention have the potential to close SES gaps in LMICs? And why this is important is, again, income inequality manifests in very young children, right? So research here, like the one I'm citing here, showing that disparities in language processing and vocabulary are evident at 18 months between children of high and low SES. And by 24 months, by the time children are 2 years old, there's a 6-month gap between children of high and low SES. All right, so early childhood intervention is important for all children, but there's this unique opportunity potentially to intervene to be able to address some of these gaps, right? Because we know that they are persistent once they're formed. So what do we know about the ability to be able to close or, sort of mediate some of these existing gaps? And in international settings, one of the challenges here is that historically, we haven't had as much data on early childhood development. And so how do we be able to begin to answer this question, how do we investigate gaps? Well, there we would want more representative population level data to be able to understand the full scope of inequality in a particular context or setting. But one of the challenges there is that often we don't have great measures of early childhood development when we're looking at population level data. If we want to understand the potential of intervention to close gaps, well, then we often need to rely on intervention studies, which can have improved measures and causal inference, but they're often non-representative samples, right? They're often much smaller, focused, targeted samples. So we might not get an understanding of the full scope of inequality there to be able to understand that. And so for this project, we're doing this, innovative literature review where we're trying to integrate these two fields of work and understand, what is the current potential of existing intervention to be able to close SES gaps. So we're conducting a literature review, like I said, but then we're also conducting analysis of new data coming out. So the multiple indicator cluster surveys is one of the most prevalent, important population level data initiatives that is collecting information on early childhood development, children's early learning and development. This new wave of survey data that is recently being released incorporates a new measure of early childhood development. So the ECDI 2030 was developed in relation to the Sustainable Development Goals and the inclusion of early childhood as a part of that. So aiming to get a holistic assessment of early childhood for children ages 3 and 4. And so this is ongoing work. This is a very initial preliminary table. At the point that we developed this, there were only data available for 8 countries. Now I think we're at 12. But just to highlight here, what we're presenting is the mean difference reported in standard deviations of both the total ECDI 2030 score and then the learning domain, right? So one of the domains covered by this story focused on children's early learning and the difference between children coming from households in the top and bottom wealth quintiles. And resonating with some of the research that we've seen in our literature review, there's a lot of variation here. There are significant gaps, but significant variation as well. So for example, here we see in Nigeria, there's a full standard deviation difference between children in the top and bottom wealth quintiles for the learning domain, right? So children who are 3 or 4 years old, there's already this really significant dramatic difference between children in the top and bottom wealth quintiles. But we look at a different context, Uzbekistan, and see much smaller difference, potentially not even a statistically significant difference. So there's a lot of variation here and a lot of interesting work to understand what defines vulnerability across different contexts. What is the full scope of inequality? How can we better target existing services? But then also, just to highlight some insights from the impact assessment literature, here's an average effect size from a meta-analysis conducted by Alaka Hall and others on the average effect size of pre-prime education. They see effect sizes of 0.12, 0.15 standard deviations. So when we compare that to, for example, the gap in children in the top and bottom wealth quintile in Nigeria of being a full standard deviation, maybe this is one way in which to conceptualize why we might need 2-generation approaches, why we might need potentially more holistic, comprehensive support to children, especially those facing severe adversity. Because this also isn't necessarily even very representative of severe adversity, right? This is quintile, so this is 20% of the population. You could think about contexts of forced displacement or children living in extreme poverty, potentially a much smaller percent of the population, potentially a much larger gap that needs to be addressed. So we're really excited about this initiative and looking for opportunities to move it forward. We hope to build on this initial landscaping and scoping work that we've done in Uganda and Colombia and offer this holistic, continuous spectrum of support to both enable organizations to design and develop evidence-based programs, successfully implement them, and ultimately assess the potential impact of 2-generation approaches to achieve these breakthrough outcomes for the most vulnerable populations, right? Is the 2-generation approach greater than the sum of its parts? Is this a potential strategy to realize greater impact that we aren't seeing with existing interventions? A key part of this work is exploring opportunities with policymakers and governments, especially in these 2-country contexts, but we're also interested in expanding to new themes in country contexts moving forward. So thank you so much. That's a really quick blitz of lots of information coming from our 2-generation initiative. But now to conclude, I'm just going to highlight a few other topics from the education sector that we're also really interested and excited in moving forward, looking for opportunities to develop more work in these areas. So I'm just going to highlight 3 very quickly. So the first is assessment. right? So over the past few years, we've seen significant advances in the work to measure learning across different contexts, and particularly global learning contexts. In our partnerships with education ministries, or at the very beginning of the presentation, I recognized we've embedded labs with 10 different education ministries. Many of them are interested in expanding their work on assessment and learning assessment. And so our ability to support them, I think, draws on lots of different types of expertise across fields, psychometrics, and education. We had a recent project working with Liberia's Ministry of Education, where they have not yet conducted any standardized exams in that context. And so we helped to develop a national learning assessment policy, and then a particular instrument that we piloted to assess learning, to develop an indicator of progress on learning for the country. That really got us deeply involved in the assessment community and literature. And we think this is a key area of interest work moving forward. That would be highly relevant to the work to support systems and infrastructure and our policy collaborations, but then also be relevant for all of our research studies as well in the field of education. The second topic is coaching. So this is one of the promising interventions highlighted in our Best Bets report that we released last year, in case you happen to see it. Coaching is a really important component of effective educational interventions, such as structured pedagogy and teaching at the right level. There's also evidence that it can be an effective standalone intervention. But one of the things that's really interesting as we approach the interest of scale and how to scale educational interventions that incorporate coaching and coaching itself is their needs for more systems and structural investigation. We need to better understand what is the current status of the coaching workforce. We might have a really effective coaching program, but unless we know how many coaches exist in a particular system, how many schools are they responsible for, what kinds of other programs are they implementing, there's a limit to the ability to scale. And so the focus of coaching is this really exciting opportunity to integrate program design, innovation, evaluation with systems and infrastructure work and understanding dimensions like the coaching workforce. And then finally, the third topic I wanted to highlight is community engagement in primary education. So the Global Education Advisory Panel highlighted this as a promising but limited evidence intervention. So when it does work, this is very cost effective. So this is a potentially really impactful and sustainable approach to improving learning and other educational outcomes. Many education systems that we work with include school management committees, PTAs, but the potential effectiveness of these bodies is not being realized. So we think there's a really exciting opportunity for a potential initiative or something to look into these issues across different contexts. And as with coaching, integrate work to design, test, innovate, effective programs with understanding the systems and contexts in which they're placed and how to best marry the two in order to realize potential impact at scale. So thank you so much. It was such a great opportunity to be able to connect, again, as always, with IPA supporters, share some of the ongoing work that we're doing. Here's a link to our website in case you're interested in learning more or donating and supporting IPA. You are also, feel free, please, to reach out to me and other members of IPA. We'd love to share more of the information that we presented today. And then also, as I mentioned, much of this formative work that we're currently doing, we hope in the next couple months to have some results that we'll be able to share. So please be in touch moving forward. But thank you so much for your time. I'm going to turn back over to Chrissy next. I think we've been collecting some questions, so we're happy to have a bit of a question and answer session.
Thank you, Sarah. That was an excellent review of many exciting initiatives that the education sector is working on. I can't wait to hear more about them. Thank you, everyone, for joining us. I just want to let you know, if you do have to drop off at 11, we will be having a recording of the session, and if you can come back. But we will try and get through the Q&A, a few questions of Q&A, and you can always reach out to us at donate@poverty-action.org, which we've put in the chat for you. So Sarah, thank you very much. We have a couple of questions that we've collected for you. I think to kick off, can you just tell us a little bit about what other context you're particularly interested in for the Two Generation Initiative?
Great. Thank you so much. So this is something that we are really excited about because it's in many cases responding to the demand for this research and evidence that we're seeing across many different country contexts. So one good example, I think, is Kenya, where our policy teams have been really involved in a lot of emerging discussions about both early education and women's economic empowerment, the national policy for care, so recognizing unpaid care activities and looking at different policy opportunities to support those dynamics in Kenya, I think are really exciting. And we're looking forward to continuing and being a part of those conversations. We are also collaborating with the Ministry of Education in the development of an evidence hub based within the Ministry of Education to coordinate and support work on relevant topics. Kenya has been expanding access to pre-primary education over the past few years. So it's a really interesting mixed provider landscape, lots of opportunities to improve early childhood education and think about, sort of the transition into primary education and a lot of outcomes there. So Kenya, I think, is a good example, but there are lots of different countries where these conversations are highly relevant and connected to upcoming decisions and policymaking. So really excited to look for these opportunities. And if anybody on the call is, connected to some of that, we'd love to follow up and learn more, but, definitely interested in exploring additional context as we also hope to continue our work in Uganda and Colombia.
Great, thank you so much. We actually also, you sort of answered another question which we got, which was how local researchers can contribute or connect to the work that you do. So please do feel free to reach out to us and we'll get those questions to Sam. So can you tell us a little bit about how you select issues or topics to focus on?
Yeah, so I think that's a great question. Again, relates to this, being a part of the ecosystem of actors in any particular country context. And so coordinating, I think the point about local researchers is so important. A real critical part of initiatives like the Evidence Hub, but then also, lots of different perspectives to incorporate there. So for example, our Peace and Recovery program, sector program, and initiatives like the Displaced Livelihoods Initiative make sure to incorporate researchers with lived experience of displacement. So understanding the diversity of perspectives that is really critical for researchers to be able to support our studies, but really interested. And IPA also has the LMIC Researcher Initiative. So we're always trying to connect across different IPA initiatives to prioritize the sort of connection to both local researchers and institutions, and coordinating that and connecting local researchers to the government partners that we're often working with. So often topics for work emerge from those conversations. So a lot of the initial engagement with institutions like ministries of education or even departments within a ministry is about setting a research agenda and learning agenda. So discussing with our partners, what are the key questions they're confronting? What are the issues that they're seeing with the populations they work with? What are some of the most important things that they would like to address? And then we are able to either, review existing research that could be very relevant or think about that as the starting point for an evidence generation opportunity. I think that's one of the ways in which IPA's work has changed the most over the past 10 years, where I think we often thought of dissemination activities as you complete a great study and then you go to disseminate. And I think we've sort of turned that on its head with our current processes, where you start with conversations and relationships, and that it's critical to that the research is designed in such a way to speak to those relationships. So it's more of a cyclical, sort of approach. But at the same time, it's trying to stay as up to date as possible about emerging research and work that's being done. I think it's also about, sort of understanding the literature as an opportunity to highlight where there are evidence gaps. So that's why I tried to do a little bit of both in our presentation today, but this is both conversations with people working in the field and working in different sectors, but then also trying to understand the literature to see where are there opportunities for evidence generation, where are there really pressing questions and key priorities that need data and information that would be really relevant to focus on.
Wonderful, thank you very much. To what extent do you feel that a two-generation approach was relevant to the various stakeholders in Colombia and in Uganda?
Yeah, and so I think this is really interesting, even things just as the use of terms. Like when we started the initiative, we were saying dual generation, and in many of the conversations, people sort of pushed back on that, said two generations is much more straightforward. But then sometimes you see us incorporating multi-generational because it's not just parents and children, but it's older siblings, it's grandparents, it's recognizing that, one of the findings from our review of how forced displacement might affect household composition is that we see households in refugee communities often have more non-biological children present within the household. So how all of these dynamics are critically important, and recognizing that language. You see a lot of the language from the US on two-generation approaches uses phrases like children and adults or parents and children. We are trying to be very intentional about using the language caregiver because in many of these global contexts, household dynamics are very different, caregiver dynamics are very different. And so we want to have that inclusive approach. And for example, in Uganda, one of the topics of discussion with policymakers has been about child-headed households and how we often don't have good data to understand how prevalent that dynamic that is. Maybe they're missing out from some of our data collection activities because of some of research protocol processes. So using these conversations again to identify and tailor the research to make sure it's as relevant as possible and really connected to the issues on the ground. At the same time, using data collection to unearth new opportunities and realize, oh, maybe there's some certain dynamics that people weren't as aware of. So really having that cyclical exchange of information.
That's great. And actually, you've touched on another question that we received. So I think maybe I'll just ask you to expand a little bit on the role of other family members beyond parents, particularly with older siblings or, other caregivers, as you said. So is there something that would integrate more alternative caregivers into future research, or do you feel like that's something that has been addressed through this work?
Yeah, I think it's such an important topic. And one thing that we're looking at in our time use study and other early research activities is some of our early research, including the work in Tanzania, has highlighted that children, very young children, are often spending significant amounts of time alone or in the care of other children. And so there have been some really exciting models about supporting young caregivers, so older siblings, but finding a way in which to do that that doesn't compromise outcomes for that older sibling. Right, so there's been some exciting work about that in Zambia and sibling dynamics, but I think we need to first learn a lot more. I think there's also really interesting work that's happening right now about further understanding and investigating the role of fathers. I think a lot of early childhood development interventions typically work directly with mothers, and over the past few years, there's this recognition and the need to incorporate fathers, but that programs didn't necessarily adjust to better incorporate them. They just added them into the existing programs that had been designed for mothers. So there's some really exciting work right now by different researchers looking into how do you design programs specifically for fathers, but then also understand those interconnected dynamics and sort of understanding how the incorporation of these different perspectives. I think the starting point is to understand those dynamics and think about potential interventions to then be able to test, but make sure you're understanding those different perspectives. So you aren't designing a program that would potentially be beneficial for younger children at the expense of older children. So understanding those dynamics and that it doesn't have to be a zero sum or a trade-off, and looking for those synergies is, I think, the goal and aspiration of two-generation work, but that we need the research to see if that's possible and if that's actually the case.
That's great. Thank you. So shifting gears just a little bit, we had a question about the most effective motivating factors for preventing dropout, especially among young girls.
Yeah, so I think that's a really interesting question and varies across the different ages and actually relates to one of the dynamics we've been looking into is that in younger ages, we actually see in certain contexts, including Uganda, Kenya, Tanzania, dropout is actually higher for boys. Like there are more economic opportunities for boys in primary education. So we see a higher dropout rates there, but things definitely change with the transition to secondary education. So I think there's a wonderful field of research on girls' education, depending upon the context, right? So there's research in Afghanistan and conflict-affected areas about providing schools closer to where girls live to reduce the travel time necessary to get to schools can be an important strategy for reducing dropout. But I think other concerns and also recognizing the interrelationship between performance in school and dropout. I think often when you come in, there's a really wonderful qualitative study by Peggy Dubek and others in Kenya that looked at when you ask children directly, why did you drop out of school? They would respond by saying, I didn't have the school fees, I wasn't be able to afford it. But when you start with a more qualitative approach and you ask children, when did you first think about dropping out of school? Children would say, well, I wasn't doing well. And so maybe children who are doing well in school, they find an uncle or an auntie, they find somebody in their network who's able to support their education. But if children are really struggling in school and not doing well, that might be the start of the, sort of experience of dropping out of school. So understanding those interrelated dynamics, I think there are other interventions like providing bicycles to girls that have been found to be successful. In Zambia, IPA has been working on an initiative focused on girls' negotiation. So giving girls the tools to be able to advocate for themselves for things like staying in school and the outcomes they're most interested in and their aspirations and desires. So I think it's, girls' education is a really complex and dynamic issue that should also be inclusive of boys and understanding these dynamics, but that we do have some successful evidence-based strategies to reduce dropout for girls. And it's really exciting that we have that body of evidence to refer to moving forward.
Yeah, that's really interesting. And expanding a little bit on the qualitative interventions and sort of using qualitative methods. Can you expand a little bit on how you adapt qualitative methods to fit the local needs of of the people being evaluated.
Definitely. And I think this is, again, why it's so useful to have that really contextualized approach to two-generation strategies, to understand these different dynamics, and even how certain settings within a particular national setting vary. So, for example, for our work in Tanzania, having slightly different approaches or recognizing the different needs or, challenges affecting people living in the Nyarugusu refugee community versus the people who are living in the host community, even though they're very geographically sort of closely located. But the qualitative methods, I think, provide this really unique opportunity to have that open, less structured opportunity for exchange to really elevate the voices of people participating in these programs, people implementing these programs. And that's often where we rely on the expertise of both our enumerators, so our teams within IPA countries who have experience working on multiple studies and honing their skills about, sort of the best language to use, the different strategies, how a focus group discussion is very different than an individual interview. And, something as basic as translation can be a really important issue, right? And so having extended conversations with the research teams and enumerators about things like what languages or what terms do we use across different languages for concepts such as mental health. Or relationships or parenting, thinking through those dynamics, and then using, sort of for the qualitative research in Tanzania, for example, we interviewed program participants, we interviewed the implementation teams, we also we also conducted interviews with local officials. So government actors and camp coordinators, working in this context to understand and get their perspective as well. And, sort of conducting these interviews, recording them, transcribing and translating them to really get at and understand people's firsthand experience of these interventions and programs, and also leave these open-ended opportunities for them to discuss the issues that are most meaningful for them, and the challenges they're facing and whether these programs are really addressing them or not.
Yeah, absolutely. That local context is so important. Okay, so to wrap up, we're returning to the two-generation initiative. And the just sort of final two questions, I'll combine them a little bit. If you could talk a little bit more about the participatory elements of the two-generation initiative, whether community members are involved in program design, how the implementation works, and then how you balance the trade-off for additional measures with the additional cost of collecting.
Definitely. Yeah, I know that's a common challenge across a lot of our research studies. We would love to be able to include, every possible measure to get this complete picture. And that's definitely a tension of the two-generation work. We wanted to interview the mother, we wanted to interview the father, younger children, older children, research comes with a cost. We're asking people for their time, to participate in these programs and survey experiences. And so trying to be as thoughtful and intentional about that as possible. And again, coordinate with a range of different actors. I think that was one of the reasons why we were so excited about this initial opportunity to do a landscaping and scoping phase. And so to connect with and interview and discuss a range of different partners and also support them in some of their own strategies, going back to this question about participatory methods, how do we support, and we're really looking forward to hopefully do this in the future, with engagements with our Right Fit Evidence team and other partners to be able to support organizations to ensure they're developing this open communication with the people participating in their program and the populations they're working to serve, to try to enable that flow of communication and raise the voices, especially of people facing severe adversity. One of the areas we're really excited exploring, we've already done some work with in both Uganda and Colombia, is working with refugee-led organizations. So recognizing that these organizations represent a unique opportunity to leverage the voices of refugee-led organizations, both in relation to the services that are targeting those populations, but then also integrating that into advocacy and more policy discussions. And so thinking about sort of this really engaged starting point before coming in with a specific intervention or an idea, an RCT to test, that this initial step is talking with a lot of the actors that are, sort of actively involved in this work and the people with lived experience of these different dynamics, such as forced displacement. And so working to understand, what issues are most important to you, what language most resonates, does this term, does this philosophy, does this idea really seem like a promising way forward? How do we design the best programs, speaking to both the evidence and what we're learning from these conversations, to then get to a point where we can rigorously assess and test to see, is this approach leading to the outcomes we're most interested in? And we be able to realize the impact that is the goal of this initiative.
Great. Thank you, Sarah. This was such an educational experience, and I am, pardon the pun, I'm learning so much about the sector and all the exciting work that you're doing. Thank you to everyone for joining us and for staying with us a little bit over. Again, if you want to reach out to Sarah, please contact us at donate@poverty-action.org, and we can collect questions and get them over to her. So thank you for joining us, and I hope you'll come next time.
Thank you so much.